Welcome back. It's Wednesday, which means Your Eye on Health with Dr. Sudip Bose, Medical Center Hospital. Doctor, thank you so much for joining us. Today we're talking about a very sensitive topic, something that many people, many of us fear, is the day you are told that you have cancer.
Right. That's a very stressful, devastating day for many people. And as an emergency room doctor, I'm often the first person breaking this news to people. And I'd like to give some tips out there, and hopefully you never find yourself in this situation. But if this happens, nobody wants to hear they have cancer. And what do? You feel lost, you feel overwhelmed. The first thing is take a deep breath. You're the same person you were before you had the cancer as after you were diagnosed. Cancer is not spreading like every second of every day. You just take a deep breath, calm down, and own your cancer. Own it, become informed, seek treatment. And when you do that, there's proper ways to do this. In the modern day, what we do is we go on the internet, search, and we try to diagnose ourselves. I would say keep away from that, because a lot of times on the internet, what do you get? You get the worst case scenario. Hey, I have this lump on my face. It's probably a pimple, but oh my God, it could be a cancer and my head's going to fall off and I'm going to die from it. So, be careful of what you read on the internet. And go to a doctor.
And also the internet doesn't, at least if you're at the doctor and you're being informed about, you're being told this, the doctor then and there has ways to help you and to help your case, rather than on the computer. You just think, oh, I have it, but then there's no solution. There's no next step that you can take right then and there.
You can't go on the internet and figure out that your stage of cancer and the treatment. You're not going to go on and see, hey, you have CIN3 with a touch of adenocarcinoma. I mean, that's stage 3 adenocarcinoma. That's not going to happen. It's basically, you need to go to a doctor. That's the bigger point we're making. Find a doctor you like. That doctor this is going to be a journey. You need to find a bond with the doctor that you get along with, and that doctor almost becomes a friend and gets you through that process. There's many help groups out there, Imerman Angels, other help groups that can provide support, and go to the right sources to get help. Because you know what, not every cancer is the same. Breast cancer is differently treated than prostate cancer and skin cancer. So you just need an expert who knows the different types of cancers, can take you through that journey, and beware of self-diagnosis and just own your cancer. And find that support too. We all need support. You can't go it alone. So find that support group or that person, that survivor that you can get in contact with to help you through it mentally as well. Exactly. Dr. Bose, thanks so much for joining us. Always great advice. And if you have any medical or health questions you have at home, go ahead and email them to the email there on your screen. We'll be right back. Stay with us.